So just in interest of keeping on time for today, I'm going to introduce the next speakers. So we'll be joined by Alissa and Caleb Godbout from the Nova Scotia Health Authority's Orthopedic Assessment and Pre-habilitation team. So Alissa is the program manager of the Bone and Joint team and the Orthopedic Assessment Clinic and Pre-habilitation team for the Central Zone of the Nova Scotia Health Authority. Caleb's the program coordinator as well for the Orthopedic Assessment Clinic and the Pre-habilitation program, again with the Central Zone for NSHA. So they're both here to talk about the Orthopedic Assessment Clinic and what's happening for patients with the knee and hips who may require knee and hip surgeries, along with the new knee and hip strategies. So I'd like to give them a warm welcome and bring them up to the stage.
Good morning, everybody. Thank you so much for inviting us. We're very excited and happy to be here. And we know that hip and knee replacement surgery is a very popular, probably unpopular topic here in Nova Scotia, given our long wait times. But we are excited to talk about the strategies that between the government as well as the Nova Scotia Health Authority have put in place to try to address our long wait times. So our goal is really around better care, access, and health for people with hip and knee arthritis. So I will apologize ahead of time. We're probably not going to have as much comedic relief as Dr. Bukowski, but we hopefully will try to keep you engaged. Just for sake of my interest, just show of hands, how many people in this room have arthritis in your hip or your knee? Okay, how many people have already had a joint replacement? How many people are waiting to have a joint replacement? Okay, and how many people have a surgery date of those that are waiting? Okay, all right. We'll get started. So we know that living with hip or knee arthritis or problems has a big impact. It impacts your quality of life, your pain, your function, your ability to do the things that you like to do in your everyday life. And so as part of this work, we're not just focused on trying to get more surgeries done. That's certainly an impact. As Dr. Bukowski had talked about previously, there's lots that can be done as you go through the stages of arthritis to help improve your health and wellness so that you can really do the things that you want to do and lead your best life and have the best quality of life possible. So the new approach to orthopedic care is multi-pronged, multi-year, and so there's various things underway to try to reduce our wait lists, streamline and simplify the access to care, so when you're waiting for your consultation for surgery as well as your wait time for the actual surgery. All of this focus around building patient-centered approaches to care. So we've had lots of patients involved in helping us to plan out what these programs look like, getting your input, and certainly there's opportunity for more people to be involved if that's something that you're interested in. Regardless of where you have surgery or where you're seen, the goal across the province is that you have a very similar experience. So we know we have joint replacement surgeries being done here in Halifax and in Dartmouth, but as well in Cape Breton, in New Glasgow, and in Kentville. So people from different areas will travel, and so our goal is to standardize and make it all very similar. And that increased focus on wellness. So yes, it's about getting your surgery done sooner if you need surgery, but as Dr. Bukowski also alluded, there's a huge important role to play looking at exercise, diet, different medications, things that you can do to try to for you to be as healthy and as well as possible as you're waiting for surgery or at a potential time that you might not need surgery yet. So what can we do to help offer you strategies so that you may prolong or delay the need to have surgery? With that, as we're looking at our patient outcomes, how can we get the best outcomes and how can you get the best outcomes in your life? And with that is decreasing your length of stay in hospital, which helps free hospital beds up to allow more surgeries to be done, and ultimately leading towards getting to the national benchmark, which is 6 months. So from the day that you decide to have surgery to you actually have surgery, the goal is 6 months. Right now, we're far away from achieving that 6 months. As I'm sure many of you can attest, people are often waiting 1 to 2 to 3 years, which is way too long when you're kind of really at that end stage and you're in a lot of pain. So what you can expect? So as we've alluded, the wellness is really going to be the priority and the focus, and that regardless of where you're seen, that you can expect the same quality, patient-centered care regardless of where you are. And you can expect that your surgery wait time will be less than today's waits, and we will complete more surgeries each year. That is already happening, and the goal targeting is that those who are added onto the list by March of 2020 can expect their surgery to be done within 6 months, or closer to the 6-month benchmark. So what is all included in the plan? So there's the orthopedic assessment clinics and the pre-habilitation program. So some of you might have already gone through this because there is different iterations that exist across the province right now. So the orthopedic assessment clinic is where you come to determine whether you're a surgical candidate, and the pre-habilitation program is a wellness program around education and exercise to help you prepare for your joint replacement surgery so that you're as well and as fit as you can be prior to surgery. We'll also have expanded our teams and capacity, so have more nurses, physiotherapists, occupational therapists, social workers. We also added 4 new surgeons across the province to help us target improving the access. With this, we're adding additional operating room time and also looking at improving our efficiencies for the ORs so that we can turn ORs over more quickly, so leads to less cancellations and things like that. Better measurement and reporting. We don't have a great evaluation system right in place to say how we do with having joint replacement surgery. So how do we standardize that across the province, and we're able to report it, and you as patients can understand what you can expect your outcome to be and have comparisons across different sites. And if we have some sites that aren't doing as well as others, then how do we work to improve that? And with that is more communication and engagement. So I don't know if many people have heard, there's been lots of stuff in the press and in the media with respect to the hip and knee action plan, and we're trying to get the information out there to as many people as possible and answer your questions and kind of share the work that we're doing and how can people be involved. So the orthopedic assessment clinic is, as I previously mentioned, one component of it. And so this has been in place in various iterations across the province. And the variation has meant that different people have experienced different experiences, and we want to try to get away from that so that wherever you go, you can expect the same level of care. So we have, as of October the 15th, implemented a single entry model. So now when you're referred for surgical consultation, it goes into one centralized wait list. So previously in different areas, you would have been waitlisted for one surgeon, and that information would have been kept at their office, and that necessarily wasn't available to everyone. Whereas the single entry model allows us, if you choose, you can choose to wait for the next available surgeon, which is often a shorter wait time as compared to waiting for a specific surgeon. And it allows us to keep the information all in one spot so we can accurately know what our wait times are, which is something that we have a gap currently in our information. We are also looking at providing more timely initial assessments. We know patients, and I've heard from some of you, thank you for popping by our booth, and we are here for the rest of the morning, is that you got referred and you didn't really know why you were being referred. You weren't planning to have surgery, or you didn't feel you were ready to have surgery. And so we have a lot of people that are waiting to see a surgeon who don't necessarily need to see a surgeon at this point. So we've implemented a nurse, and a physiotherapist will be assessing all patients prior to seeing the surgery to see, have you explored all of those conservative management options like diet, exercise, bracing, medications? Do you want to have surgery? Are you medically ready to have surgery? Do you have any other health issues going on that may prevent you from having surgery at this time? So they'll work with you and talk with you about what your preferences are. And if you aren't ready to have surgery, we work with you to develop an action plan and help connect you with the right resources to kind of put some of those things in place to help you be as well and healthy as possible. Or if you are ready to have surgery, then you'd be directed on to the surgeon, and the surgeon will be starting with a lot more information about you and kind of where things are at with you from your health status as well as your functional status as they would get from the nurse and the physiotherapist. And with that, I think we are also offering a pre-habilitation program. So at the present time, the focus is primarily on the surgical patient population, but we do hope to expand this to those who also don't need surgery at the present time. So it has been in existence in some areas of the province, so in the Valley as well as in Cape Breton currently have a pre. program, but the northern area around the New Glasgow Truro area doesn't, and here in the Halifax area we don't, but it's soon to come. So the Pre-Hab program is an 8-week education and exercise program that will give you some education on things that you can do to help yourself be well and healthy as you prepare for surgery, as well as exercise to help build your strength and your range and your mobility so that you do well after surgery and you have a good outcome and you're healthy and as fit as you can be prior to surgery. Again, also looking to offer that for those who don't need surgery yet, because as you would have heard from Dr. Bukowski early and probably heard from a lot of different people in the course of your life, the importance healthy lifestyle has and different things that you can do to perhaps stave off the progression of your arthritis or help better manage pain, help you be more mobile and have a better quality of life. Now I'm going to show you a little clip that this is in Cape Breton at the Pre-Hab program that they do have in place.
One night I thought, I'm just going to go to Toronto General tonight and they can cut my leg off. I don't need anesthesia, just cut my leg off. That's how awful it was. I got a call, and it was the best darn thing that happened to me.
The Optimal Hip Knee program has two components. There is an orthopedic assessment component and a prehab program, and it's designed for people who are awaiting orthopedic surgery on either a hip or a knee. Before these programs were in place, people seen a surgeon, they went on a surgical wait list, they got called a couple of weeks or a couple of days before their surgery, and they really didn't have a whole lot of information about what was going to happen when they came into the hospital for surgery, and they weren't physically prepared. They weren't physically optimized for the surgery.
Coming to these kinds of programs waylays a lot of your fears because they help you with every possible detail surrounding the surgery and after the surgery too. I wouldn't do it any other way.
They come into the program, they're assessed for the severity of their osteoarthritis, then they're sent to see a surgeon, and whether or not they're put on a surgical list, they come back and they have exercise and education that help prepare them for their surgical pathway.
I met with the different specialists, and they went over diet, and they went over exercises. I was sent home with an exercise plan.
It's a way for us to assess your pain, to assess the level of pain, to help you deal with that now while you're waiting to see a surgeon.
I wasn't convinced I could walk or exercise. We had a class here twice a week, and it was wonderful because we were using the machines and we were discovering that we could actually walk, but we were building up our muscles, preparing for surgery. We enjoyed being with each other, my classmates, and I actually enjoyed coming to class.
I think from the patient's standpoint is there's contact all along the way, and they're learning and they're preparing all along the way, so that makes them feel more supported in going through it, surgery.
I have a feeling I had a better result because of the people here. I think it's just an amazing program. It should be everywhere, not just in Nova Scotia. After being in Toronto hospitals, it was like nirvana here, I think, you know.
Okay, I'm going to hand it over to Caleb, who's going to speak with you a little bit more detail.
All right, thank you very much, Alissa, and welcome everyone, and thank you for coming. So my role as the program coordinator is a relatively new one, and I've just been doing it for a few months now, but before I was the program coordinator, I actually got the time to spend 2 years on the inpatient orthopedic units, where people go when they actually have their surgeries. So I'm going to tell you a little bit more about kind of the program, but also tell you what it might look like if down the road you did need surgery, what some of the new programs might look like in the hospitals.
So as Alissa already mentioned, the focus has kind of been shifting from the illness to a wellness model, and we're going to be implementing that, and we already are implementing that at all 5 of the surgery sites across the province. So it's really about focusing, you're in the hospital to get your joint replaced, but you're not sick. The day before your joint was replaced, you were at home and you were functioning. You did have a lot of pain and it was hard, but we want to replace that joint and then get you back home so you can be healthy and increase the quality of your life after your joint replacement. So as you've already seen, we do have these programs running across the province, but in the 5 surgery sites, they've been relatively different in the past. So some sites have had Pre-Hab, like you just saw, some sites haven't. So what we're doing now is we're using all the resources we have and trying to fill in the gaps so that the programs across the province are similar to each other, and that if you went to get your surgery in Halifax or if you went in Sydney, you'd have a similar experience and similar quality of care between the sites. So we've used the sites that already exist in Nova Scotia as the model of some of our programs, but there's also great programs running across Canada and across North America. And as we've been further developing our programs, we've been in contact with all these sites to see what's worked and what hasn't worked, so that we can make sure what we're doing here in Halifax and across the province goes as smooth as possible for our patients and for everyone involved in it. So we've already talked about the standardized care pathway. So across the province, we have weekly or bi-weekly meetings with all of our counterparts at the different sites, and we're trying to make sure that we're doing kind of the same thing, and trying to make sure that we're building on the knowledge that each of us has, so that we can have a provincial program that's running smoothly and efficiently, and not just doing our own separate things in each of the areas. So that goes forward with the supportive teams that we already have placed, and making sure that our programming is up to date and is innovative so that we can meet the changing needs of the population of Nova Scotia and of all of you as you experience healthcare and go through the joint replacement process. So that will lead to better outcomes for you guys as participants in your health, and also decrease the wait time so that we can get people through to their surgeries sooner, and get them home and living a healthy life again. So a little bit about what it might look like. So you've heard about what it looks like when you get assessed for the program, and then if you are a surgical candidate, you'll go through the Pre-Hab program, which you just heard about. But then what does it look like when you're actually in the hospital? So some of you, as you already indicated, have gone through this process before, and some of you are waiting for it. So if you go through it in the next couple of years, it's probably going to look different than what you've already seen. So one of the first changes is shifting to the wellness model as opposed to being in the hospital and being sick. We're trying to really activate people throughout the day, get them up and moving. In the old system sometimes, and some of you may have experienced it, people were laying in their hospital bed for most of the day. They may get up a couple of times to do some walks with a physical therapist or a nurse. So we're really trying to change that to activate people much more. So there's special recliner chairs, which you can see in the picture, and you'll see in the next picture a little bit closer. These are meant for people to, in the morning, get up right away, get dressed in clothes that you would wear at home that are comfortable for exercise, and sit in these chairs to have breakfast and work with the nurses to get your pain medications so that you're not laying in bed. Because when we lay in bed after surgery, we can get stiff, and then that makes it harder to move and more painful. So also we're up bright and early in the morning, sometimes before the sun's even up, to get dressed and to get ready with the nurses. And that's a little bit of a change before. Sometimes it took a little while to get people up, or you might be in bed for a little while. You might have your breakfast in bed, and then a physiotherapist or a nurse might come by later in the morning. So that model's changed. Everyone's up bright and early, whether they like it or not. So the other big change that we're having is we're now going to be doing group activity. So before, your therapist or your assistant, the therapist assistant, might see you one-on-one in your room, might do a walk with you in the hallway or walk around the loop of the unit. But now we already have implemented 2 times a day group therapy. So you take the nice recliner chair that you can see the gentleman sitting in, and you might walk to the therapy room outside of the nursing unit, or you might walk back. And then while you're in the actual therapy room, you're engaging in group exercise. So you're going through a series of exercises with the physical therapist and their assistant, and sometimes the nurse, to help strengthen those muscles around your surgery site and around your joint replacement. And it's really, when you do go through the process, if you do have a joint replacement in the future, if you know someone that's been to one of the programs that's changed that group setting, it really encourages people to exercise, and you can feed off of each other's progress, and you can also share what's worked for you, what hasn't worked for you in your experience. So people are finding it's much a more positive environment than, say, if you were just doing a walk in your bedroom and you don't get to share those experiences with each other. We're also implementing what are called coaches. So they're kind of like your personal cheerleader. And for many people, you may have had a family member or a spouse or a child that was there with you when you got your surgery. So we're really encouraging people throughout their whole care pathway to have someone there that can take in the education with them, encourage them, help them with the exercises, so that they have a support person right there with them through the program, including when they go home, because that's one of the parts that people find most challenging. So having a coach with you can be really helpful. And then one of the bigger changes also, we're trying to help people get home quicker, and that serves 2 benefits. People tend to recover better in their own home, as opposed to a hospital setting, which is often nothing like your home. So people are going home sooner, and in some cases it's the day after their surgery. So you'd have your surgery, say, in the morning. You might go to a group exercise class in the afternoon if your anesthetic's worn off. The next day you'd get up with a physical therapist and maybe try stairs. And then you'd go to a morning exercise and potentially a discharge class where the nurse chats with you about things that you need to know for discharge, and you get a chance to ask any questions. And then if yourself and the therapist and the nursing team thought that you were ready, and the doctor thought you were ready as well, then you might go home that day. So that's a big change from what was happening before. And there are some sites in North America that people are actually going in for their surgery in the morning, and then with appropriate supports, they go home in the afternoon. So a very quick turnover, which can be a big surprise to some people when they hear that. And just on our unit here at the infirmary, the times that people are staying compared to a year ago with this new program have decreased quite a bit. Some people are more likely to stay between 1 and 3 days, whereas a year or 2 ago they were staying more likely like 3 to 6 days. So we're already seeing improvements with that right now. So there's a little bit bigger picture of the chairs the recliner chairs that people are sitting in. So they recline all the way back. And we have exercise boards in the exercise room that help support your legs, so that you can do exercises in the chairs and also be comfortable throughout the day, as opposed to staying in the bed where you don't get as much exercise and it's not as beneficial for you. So there's close to 80 chairs that were purchased between the different sites in the province to help facilitate this. And then, as you saw in the previous picture, so to help get people feeling more normal and more like they would at home, we're trying to get people up and dressed in comfortable clothes that they would wear at home, as opposed to being in those, you've probably potentially seen the big blue gowns that sometimes don't cover everything. So getting in street clothes so you feel more normal and you're more ready to exercise. If anyone's been through the hospital, which I'm sure some of you have, when you get your clothes on, you do feel better. So we're trying to make that happen the day after surgery or the day of surgery, the first time you get up. And then going with that kind of group support that you're going to get with the group exercise classes and having your coach, we're also doing kind of like an informal competition basically with yourself, where on each of the units across the province we have big kind of boards with little magnets on them. Ours are a little sailboat, I think. So you get to keep track of your progress on how far you've walked with the therapist or with the nurse or with your coach. And you can track that progress while you're in the hospital. And if you want to, you can have a little competition with your roommate or someone that you've met in class. And it really just encourages you to keep moving and to get your strength up so that you can go home. Another component where we did a provincial review of our patient education, and we updated our guidebooks for hip and knee replacement surgery. So it's kind of like an informal Bible for your replacement surgery, where you get information about what happens before surgery, what the surgical process looks like in the hospital, and then also resources for after you do have your surgery. So it gives you education to help answer some of the questions, and we encourage people to bring them to all their appointments so that they can keep track of their progress and of the questions they have. And then when you're on the unit, we also have daily homework exercises. Most of you wouldn't have done homework for a while in that sense, but you have, for each day of your stay, activities and things you're supposed to do in the nighttime when your therapist might not be there. Once again, to keep you active. When we're at home, we don't stop doing things when 5 o'clock comes around and the physiotherapist is gone. So we're encouraging people to keep moving in the evening and keep their activity up. And then you guys have already seen some of the clips of the group therapy. So really feeding off of each other's progress and asking each other questions and talking about your experience. People are finding it really helpful, and you see people laughing and enjoying themselves in these groups. So it's been a real positive so far. So Alissa already mentioned some of the progress on the plan so far, but I'll go over a few more details. So the plan was first approved in October of last year, and we're already seeing progress. So compared to last year, this year there's been about 8% more surgeries performed than the year before. So that means the wait times, the more surgeries you do, the less you have to wait usually. So the wait list, it's almost 5% lower than it was last year. So we don't have all the parts of the plan in place now. They're being rolled out, but we're already starting to see some of the benefits from the plan happening, and then us Nova Scotians will see the benefits in not having to wait as long. So the budget's been approved for surgeons to have increased operating room time. So we want to be doing more surgeries so that we can get them completed faster. And then also all the support staff that Alissa mentioned in the orthopedic assessment clinics and the Pre-Hab programs to help people be healthier and more ready for surgery. That's the focus right now. And then in the future, we'll be trying to focus on people that don't need surgery. How can we help them to take control of their health and have the right resources to live a healthier and less pain life as they go through their journey. So Alissa mentioned there's been 4 new orthopedic surgeons hired. So 1 in the Kentville area, 1 in New Glasgow, and then 2 here in the Halifax-Dartmouth area to help do more surgeries. And then over 40 clinicians have been hired or are being hired to help support the program and to support Nova Scotians. We're also we want to hear what Nova Scotians and what patients have to say, so we've been including them in every step of the way. So as we're designing the program, we're checking in with patients that have been through the program before, because we want to know what their experiences were and what worked and what didn't work. And people have been great in helping to give that feedback, and it's always really good feedback. And we heard even more of it chatting with some of you at our booth today, and that's invaluable. And if any of you want to provide feedback, come grab us at the booth and we can take your name if you're interested. So we're getting patient feedback through all parts of the plan. And then also, as we get things up and running, we want to hear how things are going. So we're getting our patients to evaluate our programs to let us know what they like and what they don't like, and what we think we can improve. So I mentioned the new guidebooks and the new newsletters, and there's also some communication tools. So you see the website there if you want to get kind of a up-to-date progress on what's been happening in the last couple of months with the Hip and Knee Action Plan. You can go to the website to get kind of a little bit of a review so that you're up to date. And we also at our booth have some handouts that give you a little bit more information on it if you want to take some of those with you. And that's just a picture of the website, the Hip and Knee Action Plan, and then a little bit more details on some of the things I've talked about if you are able to go to the links. So I'll invite Alissa back up now, and we'll try to answer any questions you guys have. And we'll also chat about a few questions that we frequently get. So one of the questions we often get from people is how long will it take for an initial assessment once patients are referred? So once people get referred from their family doctor, how long will they be seen in? Our new goal is for the physiotherapist and the nurse to see you within about a month after that referral gets sent, so that you can start determining if you do need surgery, or if you don't, start working on some of the things that might be helpful for you to improve your quality of life.
Another common question is, what if I don't have a primary care provider to refer me, which is not uncommon. And so the first thing that we always encourage people is to make sure that you're on the list for needing a family physician, which you can access through 811. Secondly, we do accept referrals from walk-in clinics. Not that we're encouraging people to go to emergency, but so there are other avenues. It doesn't necessarily have to be your family doctor or your primary care provider. It can be referrals from a variety of sources. Once you are seen, we recognize that some of the follow-up may be challenging if you don't have a primary care provider. So we're working with primary care. We've had lots of discussions with them to date. So kind of on a case-by-case basis, there's some different clinics, access clinics that they're putting in place for these type of specialty type. If you're being seen by a specialist program and you know that you need to have specific follow-up, so how can we work with primary care to get you connected with somebody in primary care so that you can get the follow-up that you need? It's not a 100% answer, but we're going to take it on a case-by-case basis, and they're actively working on the issues with our lack of primary care providers in the province. And so I've been waiting a long time. Could I go somewhere else and have surgery sooner? Absolutely. We're seeing that more and more, and that's the goal of why we want things to look similar across the province, because you may be here in Halifax, but you're choosing to have your surgery in Sydney. So here in Halifax, we can do all of the assessment. You can go through the Pre-Hab program. You go to Sydney, you have your surgery, and then your post-operative physiotherapy follow-up can be done wherever you live. Your surgeon follow-up would still need to be done by the surgeon that did the surgery, so it does require travel, but certainly different sites have different wait times, and so us having a better understanding of your preferences and what you're willing to do and not willing to do will help direct kind of where things go. And if you're able to travel and happy to do so, there is opportunity that things may get done more quickly that way. It also helps why we're having that centralized intake of wait time. So we know across the province where the wait times are, whereas right now we didn't have a provincial sense of that. Do I have the option to go home the same day? So we don't have an outpatient arthroplasty program yet. We do have 2 of the new surgeons that we have recruited have specialist training in that outpatient program. So we are looking at how do we implement that. We do have a unicondylar program, and some people might have had that, which is basically a half of a knee. And that's being done at Dartmouth General and some of the other sites. So those, if you qualify, and you have to meet certain medical criteria, and that would be between your surgeon, your anesthetist, and yourself, as well as your family or your coach, to make that decision. So that's certainly something that you would know before you go home, before you have your surgery, whether you're going home on the same day. As we get more efficient and get better, people prepared better for surgery, that certainly could be an option down the road. But certainly something that you'll hopefully be prepared for prior to coming in. Sure.
Club at the Camp Hill, whether they work together or is it a separate thing? Because I went through the knee club.
The knee
And-
class?
Knee class.
Yes. So the Veterans Building is going to be one of the sites that we're going to have the Pre-Hab program. So for anyone who's been in that site, we have two gyms. We have a large gym and a small gym. The small gym, we've moved everybody up to the large gym. So the small gym is going to be the area where we do have the Pre-Hab program. So all of the staff are co-located in the same area. So and I manage both of those programs as well. So we are working to be coordinated together. Absolutely. Will all patients go home the day after surgery? No. We know that there's some people who have different things going on from a health perspective, and your length of stay as a result of that likely will be a little bit longer. Our goal is always that you can go home as soon as you're ready. And so we are actively preparing you to go home the next day. That's, as Caleb alluded, being in hospital is not like home, and being in your own home is the best. Hospitals are also rife with lots of other things that you can catch while you're there. So best to get home as quickly as possible and get on your recovery. So we'll take it a case-by-case basis, but we will be preparing you ahead of time so that you have things in place that you likely will go home the next day. If you're not able to, it will be day 2. And if it's not day 2, then it's day 3. But the sooner you're able to go home, it is in your overall stage of recovery is better for you. What if I don't have someone to help me at home? That also is not uncommon. So now we have a whole team that's helping you to prepare prior to surgery, and particularly the occupational therapists and the social work staff will be key. So connecting with you to figure out how we can get home care supports in place if that's what you require, working with you to potentially identify. We often, if we don't have family or we don't have someone at home, you might have a good friend who's willing to help you. So how can we work with you to figure something out? And if there truly is nothing, then how do we look at what supports are available and resources in the community to help you have that plan in place, because you still need to proceed with surgery if that's kind of the plan. How quickly will I know if my surgery was a success? So for those who have gone through the surgery who have had both a hip and knee replacement, people who generally have a hip replacement are feel it almost immediately. Your pain is gone, your hip's fixed. It's a much generally quicker recovery as compared to the total knee. Then if you go on to have a knee, you're like, what did I do? And you have a lot more pain, but and rehab is really important after a knee replacement. So generally a hip you're going to notice right away. For a knee, for the first couple weeks, it's going to be painful and you're going to have a hard time, but you'll start to notice kind of once you hit that month mark that you start to get in control of things, your strength's improving, your range is improving, you've got your medications all figured out, and then kind of by you hit the 3-month mark, you're feeling really good, and you start, you're off your walker at that point, you're generally on a cane, and you're continuing to build and to strengthen. But for each person, it's individual, and it may be also different if you've had one joint and then you've had a second joint done. Each experience is unique. Typically, once you've had one knee replacement or one hip replacement, when you have the second one, you know what to expect, so you generally often do better. But as we say, each surgery, it's its own animal or beast, and so our team certainly across the province is around to help support you, and if you have questions, hopefully answer them, and if you are having challenges, how do we help work with you to mitigate them or get rid of them? Any other questions, comments? Just come in with the microphone.
Hi, thank you. I've heard you speak of hip and knee. What about other joints, elbows, wrist? But I am particularly interested in ankle.
Mm-hmm. So we know we have long weights, and particularly foot and ankle is probably one of our worst weights, and shoulders kind of after that. So there isn't a particular focus on those joints right now, but our hope is this is not an uncommon model that exists across the rest of the world from what we call musculoskeletal triage clinics. So having a different healthcare provider, whether it be a nurse, a physiotherapist, have earlier access to patients, and then work with the patient to see, have you explored all of your options? You're ready to go on to the surgeon. So it does help fine-tune kind of that intake system. And so our goal is that once this is up and running is how do we look at other joints or other procedures. So I think it's the wave of things to come in the future here in Nova Scotia, which is a good thing to improve access for anything related to orthopedic care in particular. Yep.
First, I'd like to thank you both for presenting, and highlighting all of the great changes that have happened in the province. The one question I have is, so everything has changed as of October 15th. What about all the clients that have been through the orthopedic assessment clinic, have been told, not yet, not yet? What happens to them?
So if you're waitlisted for surgery, what we are going to work is on the Pre-Hab program, as we're going to start working, as we get those up and running, is start calling you to offer you that program to bring you in to help prepare you for surgery. If you're not on the wait list at present time and you feel like you need to be seen and reassessed, then ask for a new referral, and we would be happy to kind of bring you in and connect you with the appropriate resources. But we're kind of moving forward with kind of what the new strategy is, and then how do we work through, there's a long backlog. So those who are waiting, certainly trying to get the Pre-Hab program up and running and offer you that as you wait is kind of our first step.
Hi, I'm on the waiting list for surgery, but I'm only through the doctor refer me to his specialist. So that doesn't relate to this. Like, I have to have the doctor refer me to your program.
So if you've referred to a specific surgeon, we're working with all of the surgeons because we know that sometimes that still happens. It doesn't go to that central intake. The surgeons are redirecting anything that's for a hip and knee consultation. They're sending it to the centralized model. Anyways.
How long does that take to get an assessment?
So we just have staff in place. Our last hire was of the 29th of October, 2 nurses and 2 physios. So we've already started some initial assessments. Kind of people are learning and onboarding and orienting. So we're going to really ramp up in January. So our target is 30 days, but we know we've got a lot of people to work through. So I can't give you a specific answer on that, but certainly if you call the clinic, we can give you an estimate of kind of where it's at. Yep.
Are there any plans to have subsidized courses at the community health colleges for people who we're going to be depending on, not just for geriatrics, but also for arthritis and caregivers?
Like community-based program, just to clarify, you're asking if they're going to make community-based like education and programming, that sort of thing?
Yes.
Yeah. So we are working actively, and we have some of our team members actually used to be on the community health teams, which would be for those who are in the central zone area, might be familiar with some people. So we're connecting actively with those community health teams, and primary care is working to bring those across the province as well. That's a lot of programming that we will connect individuals with around weight loss, activity, exercise, pain management, stress management, different tools to kind of help build your own skill sets to manage your condition, or you and your family. And we are working on over time kind of whether we offer things satellite or telehealth. We're really trying to connect you with as many community things as possible. Each area of the province has satellite OACs and Pre-Habs running out of it. So here in the central zone, we're going to have one at Cobequid, there'll be one in Dartmouth, and then one in the Halifax area. In the western zone, they offer it out of Yarmouth, and in Digby, and in Lunenburg, and in Cape Breton, it's out of the industrial Cape Breton area, as well as Inverness. So we're kind of trying to tackle across kind of urban and rural, and how do we kind of make connections with everybody as much as possible. Not sure if I answered your question.
Yeah, sorry. My question wasn't courses for us who are going through different things like the arthritis, but our caregivers, people who are trained to look after us.
Okay.
Are they going to start getting subsidized courses to encourage younger people to go in to these courses to help us learn how to move, to look after us when we get home? Those types of courses. Be a step down from nurses or LPNs or whatever, but they'd be a good support. Those courses.
So we are working with continuing care. So that is kind of with the Nova Scotia Health Authority and the province for personal support workers that provide care in the home. They are a key partner around if you need home care at home and how is that program delivered. So certainly take your point. I know I used to be on the community physiotherapy and occupational therapy team, and we used to do a lot of training on the job with the workers around, here's the exercise program, this is what you have to do. And so if we need to look at doing that on a larger strategy, then absolutely, that's something that we will look at doing. We also, if you are being followed from a rehab perspective in the community, generally we rely on the community OT and PT to do that training for those that are coming into your home for your specific program, because sometimes things are quite individualized. Yep.
Hi, you're doing a great job. Thank you very much.
Oh, thank you. Thank you. Not accustomed to these darn things. I have two questions, if I may. Number one, I noticed the chairs that you were offering. Is it possible for a civilian to purchase such an item? Where and how?
So the chairs are available commercially. Certainly, if you want to connect with us, we can link you with who they're provided by Stryker Medical. It's an American-based company.
All right.
Yep.
That's great. I will be in touch with you. And the other one was pertaining to a relative. She is obese. And now I'm talking very quickly about British Columbia. It doesn't matter how overweight one is, they can have the replacements. I understand in Nova Scotia one has to lose weight. In the situation with my relative, that's just not going to happen. So having said that, what is it possible, like you were talking about continuing care, how does one, you have courses, again, for me and others in the family, to assist with that situation in the family, to make her comfortable and help others in the family to cope with her hips and knees that aren't going to get fixed. Any help on that one?
Sure. I'm going to take this opportunity to provide just maybe a little bit more additional information around the whole weight loss piece. And so there isn't a black and white standard with respect to your BMI is a certain level, and that means that you can't have surgery. Or if your BMI is a certain level, you can have surgery. It's relatively gray, and those people who do have high BMIs actually generally do quite well with a joint replacement surgery, and it's often surgeon dependent on whether they're going to do the surgery or not do the surgery. Obviously, the heavier you are, it comes with higher risk of surgery, of infections and things that can go wrong after a joint replacement surgery, which is the concern. So I wouldn't say that sometimes it depends the surgeon that you may see, whether they'll do the surgery or not. So there's always the opportunity to get a second opinion around that. And certainly with this program as well, there is dietitian resources available, and there's lots of community-based programs that are free that our team is quite aware of. And so how do we connect individuals with those programs to help with weight loss? Because sometimes even like a 10-pound weight loss can make a huge difference, because every pound of weight, they say, is about 4 pounds off of your joint. So it doesn't have to be that you have to lose 100 pounds. It might be making an effort to lose 10 pounds makes a huge difference. And secondly, I was going to say was around, lost my train of thought here. So connecting back in for a second opinion and coming in for the program, and then as around individual, certainly accessing continuing care, there's a 1-800 number that a care coordinator can come out and assess your loved one and kind of see what the needs are. And certainly if community occupational or physiotherapy sound like they might be of benefit to your family member, then they can consult them. And then generally they're kind of the individuals that would help with the training and helping you figure out tools and tips and tricks that might help facilitate function in the home for your loved one.
We have time for one more question here, and we're just going to pass it along.
Hi. Thank you for coming today. My question is there a standardized criteria that surgeons use to determine who gets a hip and when? What is that criteria, please?
So I wouldn't say, as you would have said, Dr. Bukowski alluded previously, is that surgeons are very often opinionated and don't get along and don't agree with each other often. So unfortunately, there isn't any black and white criteria around criteria for hip. It's something that we're working towards getting for both hip and knee replacement surgery. There's still a lot of variation in practice with respect to weight. BMI is probably the one that's the most variable from surgeon to surgeon. But generally, we're looking for other things like you need to have generally a stage 3 or a stage 4 degradation in your knee, or your hip. So we look at it on X-ray. Is it, the joint's worn out? Basically, the cartilage is gone. You've got lots of joint deformity. But on top of that, there's lots of people who have really bad OA, and they're quite functional, and they're getting around, they're doing those things. So you also have to look at, we're standardizing our assessments from measurements. So looking at different functional measures, like how many times can you do sit to stand in 30 seconds? How long does it take you to walk 10 meters? So looking at how does it impact your function, that will also impact. Because you have people who have end-stage OA and they are totally fine and they're not ready to have surgery, whereas you have someone who may only have like a stage 2, but they're quite functionally limited. So those things kind of impact. The good news is the RN and the physio assessments are exactly the same, regardless of where you are having your assessment done. So those are very standardized. Those routine measures that we're doing are also standardized, and we're working closely. I know in past years, Dr. Dunbar, who is kind of one of the top researchers in arthroplasty in the world, and he works here in Halifax, he's in close partnership with this project around looking at those outcomes so that we have a better sense from the assessments around what is that group of factors that you look at that help inform if someone gets a hip or a knee replacement surgery. So in short is that we're working on it. There is not a standard set that I can give you right now. And there's also lots of research doing it in Halifax. The rehab team's been working with Dr. Dunbar on a knee KG, which is basically a fancy brace that goes on your knee, and it tells you how your joint's moving in space, how your muscles are working as you walk, and it gives you a lot more objective information around what is happening at the knee to help inform the X-ray. Because right now, all we have is an X-ray to determine, and if anyone's ever heard Dr. Dunbar talk on the radio or in person, he always says an X-ray is a 2D picture of what's happening in your knee, and your knee is really working on a 3 or a 4-dimensional perspective. So this knee KG does give us that information on that 3 and 4D perspective on top of the X-ray, on top of the function. So as innovation comes along, we will also have a lot more really objective criteria, so that relying on the clinical opinion of any care provider will not be the sole reason for the decision. Will be more objective information in the future. Great, thanks very much. And
Thank you.
we do, one last plug is that we do have a survey, and we would love people to come and fill it out and give it back to us. And we are looking for more people to get involved in this and give us your opinions and your feedback on what you like about the program, what you don't like about the program, what you'd like to see. And so if you'd like to be involved, we'd love to have you. Yeah. Thank you.